We're working on the circulatory system, and we've already spent some time talking about the heart development. Now we're going to look at the vessels, the major vessels in human anatomy that stem from the heart or lead to the heart, beginning with the aorta, the aortic arch. So this is coming off the top of the heart right here, and I'm going to kind of shade this in as I go. So this is the aortic arch right here. So all the systemic blood to all the different parts of your body, except for part of the lungs, and would come from this aorta. Now we're going to do this in a way that divides up those vessels that are primary vessels, the main vessels that are above the heart, and then we're going to look at vessels below the diaphragm here in a minute. But we'll begin with the aortic arch that we see here, and it gives off three branches. The first branch right here is the brachiocephalic artery. The second branch here is your left common carotid artery, and then the third branch off of the aorta there is the left subclavian artery, and we'll label all those in a minute. The brachiocephalic splits into the right subclavian over here. So here's your subclavian heading out this way, and this is your common carotid artery, your right common carotid artery right here. Now off of the subclavian we also get the vertebral artery stemming there. Here's your left common carotid artery heading up this way. Here's your left subclavian, and it gives off your left vertebral artery here. So we'll go ahead and label these. Just label that aorta, though it's some more often just referred to as the aortic arch. Here's our brachiocephalic artery. Brachiocephalic artery. Here's our left common carotid. Artery, our left subclavian. So those are the three vessels that come directly off the aortic arch, the brachiocephalic, left common carotid, and left subclavian. Your brachiocephalic then splits into your right subclavian, artery, and right here is our right vertebral artery. And then here's our right common carotid. Artery. Off of our left subclavian right here is our left vertebral artery. So those are the major arteries we have stemming from the aorta above the heart, coming off above the heart. And there are going to be lots of other vessels, obviously, but we're just going to identify those primary vessels, the main vessels that are right immediately above the heart. Now for those vessels below the diaphragm. So your diaphragm would be right across there. Your aorta is coming down from your aortic arch. It went through your thoracic region. Part of that aorta we often refer to as the thoracic aorta above, and then after it goes through the diaphragm, we refer to it as the abdominal aorta commonly in this area. But anyway, that's the aorta. And it's coming down through here, and it's going to give off all these vessels to other organs. I want to make a point that there are three vessels. This is the first one right here. Three vessels that stem from the aorta that supply the organs of the abdominal cavity with blood. So three vessels supply all of the organs of the abdominal cavity with blood. The first one here is the celiac artery, the first of the three. We're going to go on down and shade all this in. in the aorta. So we've got the celiac artery. It branches into two other vessels. This is going to be the hepatic artery. The other one is going to be the splenic. That hepatic is sometimes called the common hepatic because it's, well, anyway. So we have the splenic and the hepatic coming off the celiac. The next one down here is right here. This is going to be the superior mesenteric artery, superior mesenteric. Superior mesenteric sends blood to the intestines, small intestines and some of the large intestines. I should say part of the large intestine. And then finally the inferior mesenteric, the lower vessel down here, that supplies primarily the lowermost portion of the colon. The lower colon is supplied there by that vessel. So we have the celiac, superior mesenteric, and inferior mesenteric, those three vessels that supply your abdominal organs, the preponderance of your abdominal organs. Make sure I get my purple in here to show those up a little bit better. So those three vessels, celiac, superior mesenteric, and inferior mesenteric. Celiac splits into the hepatic and splenic branches there. Now we have a set of vessels that will go to either side, a left and a right vessel here that would go to the general region of the adrenal glands above the kidneys. And next, we have the renal arteries that go to the kidneys, a left and right renal. And these are not going into the abdominal cavity. These stay against the back wall of the abdominal cavity. And then next down here, we have those that go to the gonads. So if it were a male, this would be a spermatic artery. If it was female, it would be ovarian artery. But anyway, gonadal arteries coming off. And down here below, we're going to show that the aorta splits into two vessels called common iliac arteries. So there's a left and right common iliac artery down here. And that common iliac artery splits into an external part and an internal part. So we have an external iliac artery and an internal iliac artery on both sides. So let's go ahead and label all these vessels now. Got our aorta. And like I said, this could be called abdominal aorta through here. We have our celiac artery, sometimes called the celiac trunk. If you ever hear about the celiac trunk, that's that same thing there. The hepatic artery, splenic artery, superior mesenteric, artery, and then the inferior mesenteric. Are three vessels that supply the abdominal organs here: celiac, superior mesenteric, and inferior mesenteric. Then we have our, these are sometimes called suprarenal or adrenal arteries, or adrenolumbar, it was in the cat. We're going to call them suprarenal here. and that's on the right side, so that's your right suprarenal artery, and over here would be the left suprarenal artery. Below that would be the left renal artery, and then the left gonadal artery. I'm not going to label the right since they're just repeated. And down here, after the split of the aorta, we have the left common iliac artery, the left external iliac, artery, and then the left internal iliac artery. So those are the major vessels below your diaphragm, those that go to your abdominal organs, and those that supply much of your back in there. In addition to these, there are smaller arteries that go off to the musculature and tissues of the back wall, skeletal and muscular features that surround your abdominal cavity. Now for the veins above the heart, looking at the venous drainage system, so we have blood coming down from the head through these vessels, from the arm and shoulder region over here. There's a vessel here coming from basically the region of your rib cage, draining blood from the wall of your thoracic region in this area right here. But let's go ahead and talk about these. First of all, from the head coming down right here, this blood is coming toward the heart, down from the head. So this is an external jugular vein, and this is an internal jugular vein. You have a pair of jugular veins that drain in on either side, both the left side and the right side. Internal and external jugular veins. You have blood coming in from the arm area out here through the armpit region. We call that an axillary vein. The axillary vein, so that would be the left axillary vein out there to the side. And then as it enters the body, we refer to it as the subclavian. That means below the clavicle, subclavian. Subclavian vein coming in. And it joins with both of the jugular veins, and as it approaches the superior vena cava here, we refer to it as the brachiocephalic vein. So this segment is brachiocephalic. Same thing is going on over here. This blood just entered the trunk of the body the way we've drawn it, so this is all subclavian. Here, over here would be axillary, and beyond that would be parts of vessels that drain the arm out there. A couple of veins out there that drain the arm. But anyway, let's go ahead and finish this here. And so all these two brachiocephalic veins come together to form the superior vena cava. All this is superior vena cava through here. And there are other smaller vessels that I'm not including here. There's a central vein that comes, a vein that's kind of centered, that comes up to the thoracic wall behind the sternum in there as well. We're not including that in the picture, and a number of others as far as that goes. This vessel that comes in over here is a major vessel that brings blood from most of the chest wall, and this is called the azygos vein, the azygos vein. Let's label all these now. So we'll start up here. Here's the external jugular. That would be the right side, so we're going to label it right. External jugular vein. I'll abbreviate V for vein. And then there's a right internal. Jugular vein. And then the same thing on the left. the left internal, jugular vein, and then the left external. Jugular vein. This was the left subclavian vein, and it's receiving blood from the arm out here, and as it goes through that armpit region, what we call the axillary region, we're going to call that the left axillary vein. Left axillary vein. So those come together here, the jugulars and subclavian, and this segment right here, this is the left brachiocephalic vein. Over there would be the right, this would be the right subclavian. Vein. And right brachiocephalic vein, and then superior vena cava. And then the azygous vein. So those are the major vessels draining blood from your head and upper body region into the superior vena cava before returning to the heart. Now we're going to be looking at the veins below the diaphragm. So we've seen already what vessels drain into the heart from above. This is inferior vena cava right here as it comes through the diaphragm. So there's a segment of the inferior vena cava above this reaching the right ventricle up there. So this is kind of a straight tube all the way up to the, not right ventricle, right atrium, the right atrium of the heart up above there is where that drains in. So here we go. We have superior vena cava, not superior, inferior vena cava, sorry, right here. And it is going to receive, not very far below the diaphragm right here, a set of vessels coming in that come directly out of the liver. So these are hepatic veins coming out of the liver right there into the vena cava. So we have those. Now recall that in the arteries, we had three major arteries supplying all of the organs of the abdominal cavity. And those organs, about all of those organs, will drain their blood into the hepatic portal system. The hepatic portal system drains into the liver, and then from the liver, all of that blood is returned to the inferior vena cava by way of the hepatic veins there. Okay, so we don't have any other vessels coming from the organs going into the inferior vena cava, just the hepatic veins. On this side, we have a separate adrenal or suprarenal vein, and then a renal vein on this side, and then down a little lower, we're going to have our gonadal vein. So that would be testicular in the male and ovarian in the female. On the other side, we see that they're kind of tied together. So we have one renal that gives off that suprarenal or adrenal vein, and it gives off the gonadal, which is testicular or ovarian, on the left side. So they're very different. Left and right, they're asymmetrical. Still supply all the organs, get all the organs, well, they don't supply, they drain the organs, but it's not symmetrical. So we've accounted for blood coming from all of the abdominal organs with the hepatic veins up there. And then from the sides, we have our suprarenal, renal, and gonadal. Suprarenal, renal, and gonadal over there. And then down here, the inferior vena cava splits into iliacs just like it was in the arterial system. So there's a common iliac that splits into an internal iliac here and then an external iliac over here. Same thing on the other side, on the left side. Now, iliac refers to the area within the pelvis, in the iliac region there, the hip bones there in the pelvic region. Once it goes beyond that, into the leg, this is referred to as a femoral vein down here. Goes in. Same thing was true with the artery. So after your external iliac goes into the leg, it's called a femoral artery. But here's the vein coming in. Let's label all these now. First of all, we have the inferior vena cava. Because these are asymmetrical, we need to label all of them, left and right. So this is our right suprarenal vein, and we could call it the adrenal vein. Right renal vein and right gonadal vein. And on this side, here's our left suprarenal, left renal, and left gonadal vein. This is still inferior vena cava all the way down to here, and this is our left common iliac vein, our left external iliac vein, and then our left internal iliac vein, and then finally our left femoral vein. We're next going to attempt to do the comparative anatomy of the heart, look at hearts in different kinds of organisms. But before we do that, we're going to do a little bit of heart development, looking back to our embryology of the heart. So say this is the head fold of the embryo right here. This is the part we're going to be concerned with in this region where the heart is going to have its origins. I'll go ahead and put the brain in here in the embryo. So this is all ectoderm in blue up here. There is a foregut coming up from the yolk in this fashion as the embryo develops, and it's between that ectoderm and endoderm that we have the mesodermal layers. Remember, our somatic layer of mesoderm comes in here, and it's going to be brought up with the head fold as the head fold grows forward. And then there's that splanchnic layer that's behind that, that's below that, next to our endodermal layer. And it's right in here in this splanchnic mesoderm right here that we have the beginning of the heart. So our heart is going to form right here, and that space between the somatic and splanchnic layers of mesoderm, and that space will form most of the pericardial cavity. So our pericardial cavity will form from this part of the coelom that's right here. So we're going to look at what's going on with these tissues, looking at it from above next, a dorsal view looking down on it. If we think back to where this was before the head fold grew up, this heart would be like laying down this direction. So it's brought up and over during development. So we're going to be looking at what's going on in the early stages of development, looking down on that from the top next. We're going to make a few drawings here of the heart and during development. Again, we're looking down on the heart from above where that head fold grew up and over. So this is what's happening in that splanchnic mesoderm layer. We get this thickening to form here. And within that splanchnic mesoderm, we're going to develop two tubular structures in here. So there's a right tube and a left tube in here. And those are going to be blood vessels. And eventually, I don't usually fill it in here, but anyway, this would be the left vessel as we look down on the top, and there's the right. And the entire vascular network in front of that and behind that has not begun to form yet. So we just have heart elements here. And these cells in this early embryonic heart have already started to undergo their individual autorhythmic contractions in those tissues. The next thing that happens is these two tubular passages that are developing in that splanchnic mesoderm come together and form a common section in the middle here. So it's divided in the front and in the back. But in the middle here, there's one common space. The heart is going to develop from that common space right in here. Back behind, these are going to contribute to the vitelline veins that receive blood from the yolk, and these are going to contribute to the formation of the early arterial branches toward the head that form the aortic arches up there in the front. So that's the next stage of development. Let's see, if we were to draw the next stage in here, we would have that branch that leads into the aortic arches up there in the front. And then we'd have a slight enlargement here that forms the ventricle. And then another section here that's the atrial region. And then the veins that drain in from behind back here. So here's your two-tube heart that we start with. They fuse together in the middle. They make a single tube in there, and then eventually that single tube forms a ventricle. This is more anterior toward the head, and the atrium back here. Now, these are the two primary chambers of the heart. When we talk about a two-chambered heart, or a three-chambered heart, or a four-chambered heart, we're talking about numbers of atria and ventricles combined. In these more primitive organisms, like some of the fish, we have a segment in front of the ventricle up here called the conus arteriosus. That leads into those other arteries. Ventral aorta may form in there. And back here in the back, where we pull the blood together before it enters the atrium right here, there's a section we sometimes refer to as the sinus venosus, back in the back. Those are not considered part of the heart chambers, but they're important components in, especially in the fish heart, those segments. Next, we're going to see what happens with the atrium and ventricle, because we know that in our body, the atrial chambers are up on top and the ventricle is below, and this is the reverse of that. The ventricle is up toward the head and the atrium back behind. So, in these two drawings of the heart, we're looking at the heart from the side. It's a lateral view. Up in the front, we have the beginnings of separation of our aortic arches that will go around our pharynx. This would be the conus arteriosus portion. This would be our ventricle right here, ventricle of the heart, and then the next chamber back would be the atrial chamber of the heart. Our sinus venosus would be back here. Now, as the development proceeds, in the next picture we see the atrium moved up and over the ventricle moved down and below the atrium like this. And that process continues in the next picture. There's your atrium, there's your ventricle. So now we have the atrium up on top and the lateral view, and the ventricle is moving further posterior. This would still be our conus arteriosus in here, and our sinus venosus would be about right there. And a little later on, things become even more exaggerated as the atrial chambers move up, the ventricle moves to the back, so your atria are now on top of your ventricles. Blood draining into your heart from behind, from that old sinus venosus location, comes in just above your ventricles, and blood from the ventricle is pumped up through this section right here. This is sometimes referred to as a ventral aorta. It's a portion of that old conus arteriosus also in there, but anyway, and your aortic arches coming off up here to go to your pharyngeal arches in that region. So this is how your atrium becomes positioned above your ventricles during development. In something like a shark, when we do shark dissection, we see that it looks something a little bit more like this intermediate stage, where the atrial chambers are kind of positioned posterior to the dorsal side of the ventricle, not all the way up to the top. But in mammals and humans specifically, we have atrial chambers positioned up above our ventricle. All of our vessels drain into the heart, we know, from the very top part of our heart, the upper portion of our heart, not into our ventricles back behind there. Our next point here to talk about is the spiral valve formation in the conus arteriosus. In the fish, there's no need for a spiral valve formation because we don't separate oxygenated blood from one side of the heart from deoxygenated blood on the other side of the heart. It's all deoxygenated blood as it comes through the heart in a fish, and it's going to the gills. But when you start using lungs for your respiratory organ, you have an oxygenated blood coming from the lungs and deoxygenated coming from other parts of the body. So here in the conus arteriosus, as the development of this region forms, and we start getting our different aortic arches and things to develop, a spiral valve forms in that conus arteriosus region. Our ventricle would be down here below, and there would be, well, anyway, kind of a valve arrangement here below that. But the blood coming up from the deoxygenated blood that's coming up on this side of the heart over here, it's on the right side of the heart, it's going to be shifted over. You just draw some arrows here. This side of the heart is receiving blood that has been to the body. So it's going to be moving up through here, move through this spiral valve and be routed into the sixth arch, sixth visceral arch here, which eventually becomes a route to the lungs, the pulmonary circulation there. So this is going to be our pulmonary trunk coming right across the front of our heart. As we've seen in the other heart diagrams, we've got the pulmonary trunk coming across here, and the oxygenated blood that's coming from the lungs comes in on the left side, and that blood coming in on the left side, even though the heart may not be completely divided back here in amphibians and reptiles, for example, that blood is coming up through here, and it's going to be routed behind that and come out over here and go into our main aorta over here. So anyway, this is a spiral valve that kind of sends the deoxygenated blood to the lungs, to the pulmonary vessels, and the oxygenated blood then is routed out to the systemic branch through the aorta. So there's our spiral valve. Forms in our conus arteriosus. This here would be our pulmonary here, and this over here, this is aorta coming out of the heart. In an amphibian, we only have a very little separation in our atrial chambers between the oxygenated and deoxygenated blood, between systemic and pulmonary branches. In the reptiles, we have more separation of our atria and ventricles, but not complete separation. So down here below, there's a common space, but there's more or less laminar flow of this back here. So that deoxygenated blood kind of stays on one side and gets shifted over to the pulmonary, and then the oxygenated blood kind of stays on this side as it flows forward and gets routed into the aorta. In mammals, we have complete separation back here, so we get all of the blood routed behind the pulmonary and into the aorta. That's the oxygenated blood on the left, and all of the right side blood stays in its specific side, that's right ventricle, and is routed up through the pulmonary trunk into the pulmonary arteries that go to the lungs. By the way, we see this in amphibians, reptiles, birds, mammals, and in birds and mammals and higher reptiles, instead of just having a twist inside of here, imagine that this side of the twist, the aortic side, expanded and became very large, and then this side of the twist expanded and became very large. It's almost like there's not a spiral valve in there anymore because the vessels have become so large beyond that, it's really not evident. But in a frog and in some reptiles, you can still see evidence of that little twist inside of a conus arteriosus at the base. In this series of illustrations, we're trying to show the separation of chambers of the heart in the different taxa of vertebrate animals, starting with the fish, then the amphibian, then the reptile, and then the bird and mammal kind of example over here at the end. In the fish, we have a region back here where all the blood connects in there called the sinus venosus, I'll label SV. And then we have the atrial chamber, then the ventricular chamber, then the conus arteriosus, and on out. And we've talked about those things before. It's a straight line kind of event. The atrium chamber will be moved up dorsally, so it's kind of side by side with the ventricle. But anyway, the blood comes into the atrium, then into the ventricle, then conus arteriosus, and out to the gill arches. So it's a straight line thing, deoxygenated blood coming in, and we're going to send it to the gills to get oxygen. The rest of these are all terrestrial. They are not gill breathers. So frog, maybe a lizard, there's some kind of mammal over there on the end. This is what we just talked about with the spiral valve formation. We've got blood coming in from pulmonary over here on the left side, your left atrium. This is your right atrium that receives deoxygenated blood. So you have on this side deoxygenated blood. It's going to be routed through the spiral valve and into the pulmonary artery. I'll label that PA, pulmonary artery, and this over here is the aorta on this side. And there's your spiral valve. This would be the region of your conus arteriosus up here. There's your ventricle. So you have partial separation of the blood flow, not complete separation of the blood flow. So if we have kind of a laminar flow through the ventricle, we'll send most of our right side blood, our deoxygenated blood, into our pulmonary artery, and most of our blood that's been to the lungs from the pulmonary vein over here into this side, and it'll be routed across to our aorta. Reptiles do a slightly better job of that. They have a little more complete septum in our ventricle here. So we have still, this is our pulmonary vein. I'll label that PV now, sending blood up through and into our aorta at the top. We really don't see much of evidence of the spiral valve in there as much because these vessels kind of form their own body away from that separation as the animal grows. So let's see. We have our right atrium, our left atrium. This is our deoxygenated blood coming in from the body, so all this is systemic. we could say, on this side, this blood coming in, and it's put into our pulmonary arteries up here at the top. Not much room for mixing in there. It's said that crocodilians can kind of close off this opening when they're on land, when they're breathing air on land, and when they dive, they don't use their lungs. When they're underwater for a long period of time, they can allow some mixing of the blood in your ventricle in there. So crocodilians are kind of facultatively four-chambered. They can be either fully four-chambered or like 3.5 chambered is this example here. We refer to this as a 3-chambered heart. This is a 3.5 chambered heart. And then finally a 4-chambered heart as we see in humans. So we get our systemic blood out here, our pulmonary vein blood here. Here's our left atrium, right atrium, right ventricle, left ventricle, pulmonary artery, aorta. Now these are diagrammatic, shown in kind of a straight line form. We know that the aorta, the atrium moves on top of the ventricle in like a shark, and in the rest of these, the atrial chambers move completely up on top of the ventricle, and the ventricle would be displaced below. So the blood goes up and down and back again through the heart. We're going to look at a series of diagrams now showing the aortic arches and their fates. The first three we have here, this is the embryonic state, this is a fish-like heart, and this is an amphibian-like heart. Next, after that, we're going to do reptile, bird, and mammal. But we're going to start with these three. The embryonic condition, and this is a little bit fanciful. Maybe it's not exactly what happens in reality. The aortic arches, as they start to form from the early ventral aorta and conus arteriosus region, when they first grow out here on the front, they start off with number 1 here, number 2, and then eventually they add number 3, and about the time number 4 starts to form and number 5, numbers 1 and 2 are going to be gone. So we lose those pretty early on in development of most species, but over time we get a total of 6 aortic arches to develop from that ventral aorta and conus arteriosus region of the heart. As those vessels then feed into a dorsal aorta, and there's a right and a left dorsal aorta. So if we're looking down on the top, this would be the left dorsal aorta in that kind of a view. If we're looking from the bottom, it'd be reversed. That would be the right side. But anyway, this is how things start out. In a series, we get 1 to form, then 2, then 3, then 4, then 5, and 6 from front to back. The dorsal aortas, left and right, feed into eventually a single dorsal aorta here in the anterior part of the animal, not too far behind where the heart would be located, or about where the heart would be located. That occurs up dorsally, leading into that long dorsal aorta, going down the middle of a fish. Here we are with the fish. 1 and 2 are gone. This is number 3, this is 4, this is 5, and this is 6. Here. There are vessels that extend from the previous bases for arches 1 and 2 here. They form the external carotid arteries. These over on the side over here, these are going to be internal carotid arteries, even though they're actually part of the aorta, that anterior extension of the aorta. So we still have the left and right aortas above, and they come together as one down below. So these 3, 4, 5, and 6 supply the gill arches in a fish. So the blood supply to each of the gills comes from those arches. Next, as we transition to the amphibian, the frog example over here, remember we have the spiral valve in the base and we have formation of pulmonary arteries. That is from this base of the sixth arch. The sixth arch no longer connects to the aorta on the side here. So we still have a left and right aortal portion there. This anterior part of the aorta that we had up here no longer is connected. So we still have the arch number 3. We still have our external carotid. I'm just going to label it external C and then internal C up here. So those vessels leading to the head supplied from this base here and off the third arch. This is arch number 4 on either side leading into the aorta. So instead of one aorta like we have, they have 2 aortas. Now 3 more diagrams. This is reptile, bird, and mammal. Reptile, bird, and mammal. So we still have in here the third arch component. This is a fourth arch component. This is a fourth arch here. This is 6 and this is 6. So coming up off the heart, we have separation of the pulmonary and systemic circulation here, so that the pulmonary goes into 6. Good to go to the lungs. Systemic circulation stays in 4. Now, this is the right side over here in the reptile, looking at the overall anatomy, the shape of things there, and this is the left. So we have separation of our fourth arches pretty much in here, and off of the right fourth arch we get the supply that goes up to the carotid arteries up here at the top. In the bird, we keep the right arch, the right side arch, and this is still pulmonary number 6 down here, and it doesn't go all the way to the aorta. It's diverted to the lungs. This is the fourth arch here, and third arch is here and here. The carotid's still up there. This is essentially a brachiocephalic type vessel in between. Mammals have a very similar arrangement to the birds, only they use the left fourth arch. The left fourth arch instead of the right fourth arch. So the reptile has both left and right, uses primarily the right in most species, as the bird uses only the right, no left. In mammals, though, we see the adoption of the left fourth arch as the primary aorta to supply the body with all the blood that it needs, all the systemic circulation through the left fourth arch instead of the right. So anyway, there you have it. Of course, the pulmonary is still 6, and the carotid's bases up here are still from arch number 3 remnants up there at the top.